So I hope you all have a good lunch. And you know what that means, right? That means your stomach expanded a little bit and sent impulses up your vagus nerve to the ventral median nucleus of the hypothalamus, which inhibited feeding, so you're not hungry anymore. And it caused a sense of satiety. So you're satiated, you're happy, you're relaxed. So now let's talk about pain. Pain is a very interesting thing. How many people here have experienced pain? All right. How many people here went to the doctor for pain? Less. Pain's an interesting thing because most people have it some of the time and the rest of the people have it all of the time. So it's ubiquitous. Everybody needs an Alpha-Stim. You know, you keep some aspirin around the house, some Band-Aids, why not an Alpha-Stim? Because it can do a lot more than what's on label, and we're going to talk about that. So what is pain? It's sort of like defining what a banana tastes like. Anyone want to give a go at that? Besides the obvious, it tastes like a banana. And that's kind of a circular logic that doesn't play out well over time. So what we think about is in pain is a lot of different things, but mainly the experience and the fear, because pain is frightening, especially if you don't know why you have pain. One of the things that causes stress is not knowing or not being in control. You know, if you're controlling your job, you have a lot less stress than if someone's telling you what to do and it's unpredictable. Or if you're given a task to complete and no budget to complete it with or something like that. So pain is very stressful. Pain is very scary. The Greeks actually called it an emotion, the opposite of pleasure, the ancient Greeks. And fast forward to the 17th century and the great French mathematician, philosopher, and neuroscientist René Descartes developed the specificity theory, which unfortunately a lot of surgeons operate based on that today, which is that it was also called the bell tower theory, which means that basically you put what we call a noxious input, something that causes pain, into the nervous system. It sends a signal up a specific path to ring a bell in your brain in a specific place having to do with a specific part of the body, specificity theory. And so neurosurgeons say, well, I'll just cut that nerve and you won't have any more pain. It doesn't work. So they didn't have all the answers in the 17th century, but it was kind of an interesting concept. About the 1800s, there was the summation theory. This is a good one because somebody noticed that you can lean over and pick up a feather and like pull your back out. So you lean over, pick up the feather, and you can't move because your back hurts so much. Well, that didn't happen from picking up the feather. That's summation. All the little micro pains that you didn't even notice just added up to one big pain. We can treat acute, chronic, and postoperative pain. So what's acute pain? It's a pain of short duration. And the process is much, much more complicated than I just let on. I mean, there's chemical cascades, but there's also electrical properties. And the electrical properties of the body precede and control the chemical properties. So why did chemistry win? Why did chemistry rule over physics and become the master science of medicine? Because chemicals are something you can put in your hand, you can feel, you can taste, you can hear, if you shake them up by your ear, and you can smell them, and of course you can see them. Electrons are more elusive, harder to spot. You know, I have some in my hand. You probably don't notice those, do you? No. Not only do I have some in my hand, but as I put my hand on this table, my electrons in my hand and the table kind of interact there because they're all just like electron clouds. Someone asked me, does a psychologist write a prescription? No, psychiatrist psychologist writes an order. Psychiatrist writes a prescription. So that's kind of important terminology too, because if you tell a psychologist, I need you to write a prescription, the psychologist says, hey, wait a minute, I can't write prescriptions. So they think they can't get an Alpha-Stim for their patient. But they can because it's in scope of practice. If it's pain, that might be a gray area for psychologists. But anxiety, depression, and insomnia is definitely in their scope. On the other hand, a dentist could prescribe it for anxiety, but I wouldn't recommend dentists prescribe it for depression. Physical therapists in the, I think, 19 states that they can see patients off the street without referral from a doctor, they can order it for a patient for pain, but not for depression. So pain is a interesting, ubiquitous thing, and think about it. Somebody gets pain, oh, 3 types, acute, chronic, and postoperative. So acute is generally defined as less than 3 or less than 6 months, depending on who you're reading. And chronic is more than that. And traumatic is what it sounds like. And you can have traumatic pain. Let's say you're in the military and you get your leg shot off. That's traumatic pain. And you're going to have it for life, or maybe it can be controlled. But the other thing is it can come from within, exogenously, where you can have like rheumatoid arthritis, for example, which is sudden onset. And last week you were fine, this week you're in a lot of pain. And usually you let it go for a little while. I mean, you know, if someone's put a knife in your back, you might go to the doctor right away, not see what happens over a week or so. But if your joints just start to hurt, you know, oh, I'll take an aspirin or Advil or something, and then let's see how this develops. But eventually you go to a doctor and the doctor says, well, you have this diagnosis, whatever it is, or don't know, it's idiopathic pain. So basically, the person who is just going along, living their life, hopefully happily, and they come down with this pain, and then it becomes scary. And they go to the doctor, and the doctor says, well, I don't know. We can't measure pain, so whatever you tell me is real, 0 to 10, and I'll give you some drugs that'll counter the pain. It does nothing for what causes the pain, but it will reduce the symptom. You'll feel a little better 4 hours at a time. And that's an awful way to live, from pill to pill. Not to mention that the biggest problem, of course, is tolerance, where you not only cannot take it anymore because the dose is too high and will kill you, but it actually becomes less effective as you go on. So now the patient's been on narcotics, it's drug, you go up the drug chain and you play the pain game where you go from doctor to doctor. And I've heard so many, many crazy stories. I mean, there was one guy came to me and said, you know, I took a history, I used to practice. I took a history and I said, and he said, I've been going to orthopedist and I've got injections every week for the past 1 year. I said, how's that working out for you? He said, well, it really didn't help. It makes the pain worse for 3 days, then it feels better or the same as it did before for a few days, and then I do it again. What did you do before you had pain? I was an engineer. I'm thinking, engineers are usually not idiots. But the definition of delusional disorder is doing the same thing over and over again and expecting a different outcome. So why would you do 50 times? Because that's what they offered them. And because the person got a sore throat when they were a kid, and the doctor gave them antibiotics and they felt better, even though it was a virus. It wore off. But now they have something that didn't wear off. So the doctor is trying to manage it. We talk about management or control. We don't curse in medicine. We don't use 4-letter words like cure. That's the dirty 4-letter word. In medicine, we try to stay away from. Because, let's face it, medicine is a controlled industry. It's controlled by the government, it's controlled by the American Medical Association, which is not a benevolent society. It's a union for physicians. It's a controlled monopoly. And then it's controlled by the pharmaceutical industry. And I've always said, if you walk into a drug company and say, hey, I've developed a cure for arthritis, you just have to take 1 pill a day for 10 days, and you will never have arthritis again. Chance of you leaving that company alive is slim, because that's not what they're looking for. You know, they might spend $100 million in developing a drug that's eventually going to cost them $800 million to $1 billion these days to get on the market, which is why we're kind of opposed to the whole PMA route. They're $100 million into developing and say, hey, this drug really works great. We better stop it now. Just throw our $100 million out before we kill our whole drug line. You know? So, you know, that may sound a bit down on the whole thing, but it's true, and you know that. So let's get back to this person. So now they're in a doctor's office, and they say, I've now had pain for 2 years, 3 years, 20 years, whatever. And it's just taken over my life. I can't work. I've lost my family. I've lost everything. I'm drinking. I don't get enough drugs, so I take some that I get from a guy behind the alley about 2 blocks away. And I'm just miserable. I can't remember last time I was happy. And the doctor's thinking, gee, how long do I have to spend with this person? And then you come in. And this person, who's been going to all these doctors, trying all these different things, then this person is faced with you. And so what I want to emphasize is that when you're in the office, you're dealing with somebody who needs you and who you can help. Our North Carolina rep here told me paychecks of the heart. Thank you. I'll remember that. That's what I love about this business. There's 2 things I love about this business: helping people, and which gives you paychecks of the heart, and meeting healers. When Mike started working for us, when we interviewed him, I said, and you were in the orthopedic business for like 10 years, and I said, you know what's the best thing about this business? You are going to meet doctors who are just wonderful people. They're the greatest healers. They stay up nights worrying about their patients. They look for solutions. They're just amazing. You've got this person in front of you, and you got this doctor too. And you've got to divide your attention. Don't treat the patient like a piece of meat while you're trying to impress the doctor. You really need to impress the patient, and you should ask the doctor, can I have your worst patients? Because worst patient's going to show more change. I mean, if you say, I don't have a headache, treat my headache. Well, I still don't have a headache. You know? Now, on the other hand, you usually can help this person, and you need to go in there with the confidence that you can do that, but you also need to go in there with sympathy and not empathy. And what I mean is care. I mean genuinely care. You have to care because you're dealing with people that hurt. And you'll get your heart paychecks or whatever that is. And hopefully real checks too, as money checks. But money is a means to an end. It's not the end. So, you know, you can make money doing what you like, then you never have to go to work. So focus on this patient, look them in the eye, and say, I think I can help you. I'd really like to try. And mean it. And then you will see miracles happen, because the first thing you're going to sell is something that this person doesn't have. Before you touch the person with the probes, demonstrating, you don't treat, you demonstrate, right? Before you do that, you're going to sell hope. And that's what this person needs the most at that moment. They need hope. So you're going to sell them on this concept of hope, and then you're going to deliver. Now, you're not going to deliver every time, but you're going to deliver more times than anything else on the planet. You know, I had a bit of an argument with a very renowned pain specialist in Seattle. And he said, I was talking about morphine resistance, and he said, there's no such thing as a morphine-resistant patient. It's a matter of dosage. And I'm like, well, as you know, that's true. And pain is a really good cure for, death is a really good cure for pain. You know? And so yes, you can absolutely kill the person and lose the pain. But that's not the best way to go about these things. So have good faith, because there is nothing that comes close to Alpha-Stim. I said in that documentary, there's nothing that works as well for anxiety. And by the way, the only thing on the market besides drugs for anxiety and psychotherapy is Alpha-Stim and its minor competitors in CES. There's nothing else. We do have device competitors in depression. They don't work very well. TMS barely works. VNS doesn't work at all. They don't have a shred of evidence. And yet those are implantables, or VNS is implantable. And then there's this concept of deep brain stimulation. That's just dumb. Cutting open your brain and putting wires in. I can easily show you that if I put an electrode on the top of your head and one on the bottom of your feet, with Alpha-Stim at least, it'll penetrate your whole body. So why do you want to cut open and put things in? Osteopathy is based on the concept there's no empty spaces in the body. If something is out of place, it's going to move something else, and eventually interfere with function of the body. So why would you want to put things in the body, like, you know, fist-sized tumors, even though they're theoretically benign, the devices themselves I'm talking about. Yeah, I was called to consult on a case at the Houston VA, DAAPM VA, and they said that they gave me the whole history, and she had like 4 stimulators, or 3 stimulators and a morphine pump inside her. And they said she's intelligent. She's on a cart and she's like this. She's on so many drugs, but she's intelligent. We're going to bring her in here. I said, don't do that. They said, why not? I said, because, and I had a whole bunch of doctors in the room. I said, because I'm going to be using the word iatrogenic a lot, which is physician-induced disease, by putting all those things in her. And I said, you may not want her to hear what I have to say to you guys. So the first year, Tracy showed you some slides of the old Alpha-Stims, the original Alpha-Stim 2000. There's one in the back, if you haven't seen one in person. That took 64 hours to build by hand. And everyone in the company, which was me, sold 6 in the first year. We started in October, so what we need to discuss now is what the Alpha-Stim is doing and how do you do it to treat pain. And that's going to continue tomorrow morning in our workshop settings. I'm going to be talking about headaches, and other people are going to be talking about whatever they're going to be talking about. You have that program. All right, Jeff saved me a lot of time because he went through some of the slides. So I don't have to explain these slides. I did want this one because of the pain and headache. Jeff was doing these. I'm doing pain and headache. So I'm going to say, oh, it's just like what he said about the other things. You know, the blue and the purple lines are close or equal or better than the other lines. And these are the main drugs. I mean, everybody's heard of Vicodin and OxyContin. So we just went to WebMD. We folded all the results from our surveys into one question. Did it work for you? And we found almost the exact same question on WebMD, very popular website. And we put those next to each other and we said, hey, this works as well as the best drugs on the market. But it actually works better because absence of pain is not the ideal situation in life. Alpha-Stim can take you further into normal functioning of the brain and the body, all of you. And so Alpha-Stim can make you better. That's why I said, even if you don't have anything. All right, I've got a few slides here before I get into some of the others that Jeff has already shown. This is one of my favorite little things. I started in the military at William Beaumont Army Medical Center, El Paso, Texas. And the military has too many patients, like the VA. You know, people are dying waiting to get into the VA. And so the military needed efficiency. So I came up with the idea of, why don't we just put 10 chairs in a room and have one person monitor the room, and you know, at 20-minute treatments, you can treat as many as 30 people an hour in one room with one person. We did that. And that was with Colonel Rich Petrie, good friend of mine, PM&R, physical medicine and rehab doc, integrative medicine. And I've known him for a long, long time. We're both board certified in pain management. So this is DAAPM Medical Center, I had mentioned a minute ago as well, in Houston. We did a lot of work there. And veterans were told, you can come into a clinic anytime from the pain clinic, and they trained them on these 5 devices, and they said you can use any one you ever want, whenever you want. No charge, of course, it's the VA. And you don't need to make an appointment, walk-in clinic. Make it convenient, easy for them. And so a few things came out of here. One was 3 out of 4 veterans who chew gum preferred Alpha-Stim. You remember that stupid commercial? Yeah. For those of you from out of the country, this thing ran for decades on TV. 3 out of 4 dentists recommend sugarless gum for their patients who chew gum. That's one of the stupidest ads I've ever heard. I mean, who's the 4th dentist who says to their patient, look, if you gotta chew gum, make sure it's full of sugar. But it just doesn't sound so good to say 4 out of 4 dentists. Could say 5 out of 5, 15 out of 15. But somehow 3 out of 4 worked. So I like to say 3 out of 4 veterans chose Alpha-Stim. And then, so that, you know, that's a lot. This is Stress Eraser. I really like the Stress Eraser. It's off the market. I had an opportunity to buy it. I didn't have the money. And now I do, and it's gone. They wanted to sell me, I think they had 100,000 units plus the plans. And I was just, well, that's a bit much for me. But it was a great little device. You just put it on your finger and it tells you when to breathe. And it does heart math. It coordinates your heartbeat with your breathing. And that's very, very therapeutic. I love breathing. No, really. I mean, I love breathing exercises. I always like to teach breathing exercises because they're very effective, they're very cheap, and you have them with you all the time. And then they're free. So this is the results of the 3 out of 4. But this doesn't pull out Alpha-Stim. We probably would have got a little better results if we just look at the Alpha-Stim data. In this case, what we're looking at is the 3 out of 4 plus the other 25%. But look, it's great results. I want to point out that the best results by a hair is in well-being. At Fort Hood, the Warrior Reset program, right? At Fort Hood, yeah, they were telling me, it's funny because our psychometrics don't show improvement in anxiety so quickly, but their feeling of well-being goes way up. So what does that mean? That means we don't measure things really well, but the person feels better right away. That's what happens first. So feeling of well-being, and that's important. Don't you want to feel good? That's an important part of life. We're not just trying to get rid of symptoms. We're trying to feel good. Sleep, anxiety, pain works really well. And this was a pain clinic, so these people all had severe pain. They had these other things. And depression we always see lower. We can usually hit the 50% mark, but again, 25% of this was not Alpha-Stim. Nevertheless, I claim the whole thing because 3 out of 4 is close enough. What about selective serotonin reuptake inhibitors? It's inhibiting the enzymatic action that breaks them down and takes them back. So almost 100% of drug therapy for the things we're discussing, neurological, even if they're not. I'll get back to that. Almost 100% takes place at the chemical transitions, of which there's 2 going up, afferent, one by the spine and one in the brain, thalamus. And so this is where drugs work. But, says Candace Pert, the greatest receptorologist that ever lived, formerly of the National Institutes of Health, you should read her book, Molecules of Emotion. It's fantastic. 2% neuronal communication occurs at the chemical synapse. 100% of drug therapy for what we're treating occurs at the chemical synapse. You see the problem? And why you need more and more drugs? All right, so what's really going on here? There's electrical synapses and there's chemical synapses. Electrical synapses precede and control the chemical activity. And they also give you time to respond. Now, this the electrical ones are more of a local phenomenon, whereas in order to get far distances, you need electrochemical changes along the nerve. And so, so they're different, but they coexist. So, did you use this one? OK, good. So this doesn't actually show that the nervous system is pink, blue, and yellow. What it shows is that it's a very complicated mass of electrical and chemical changes that occur every moment of life. The electrical network is more of a current concept. There's an excellent book that's out of print called Biologically Closed Electric Circuits. And that's by Bjorn Nordstrom, who was the chair of the Nobel Assembly. He was a radiologist, diagnostic radiologist at the Karolinska Institute in Sweden, where they issued the Nobel Prize. And he was chair of that. And he came out with actually 2 books on treating cancer, because he looked at an X-ray and he said, there seems to be like a corona, like the moon eclipsing the sun, around a tumor. Now, I worked in radiology. It was one of my first jobs in medicine. And radiologists will put up some X-rays while they're dictating and then pull it down before I can focus my eyes. So most of them see what they're looking for, and they know what to look for, because that's what they were taught. But when you get to be like top radiologists in the world, one of the foremost medical institutions in the world, chair of the department, you look a little harder. And he said, there is something weird about what's going on around this tumor. So he proceeded to study that for a few decades, and he successfully treated cancer by using various, at first he implanted electrodes and then he put them on the surface of the skin. What I'm telling you is that the body has this amazing electrical system. I think the first ones to notice it were the Chinese. They called it qi. What is qi? It's vital force, some kind of a energy in the body. What is electricity? Some kind of energy. It's the same thing. Bioelectricity. I mean, you can measure it. It's there. So what the Chinese call qi, which is polarized, yin or yang. What is electricity? It's polarized, positive or negative, right? It's all the same. So the Chinese made this observation first, and about 5,000 years later, or maybe more, American medicine is waking up to it and figuring it out from a different perspective. But this whole system is going through our body, and it controls us. And it even extends beyond our body. And you can actually photograph that with electrostatic plate photography, also known as Kirlian photography. So we can look at these things and say, OK, how do we make use of this? What can we do with this information, this knowledge? All right, a ligand is like the drug going into the receptor. Receptors have 2 or 3 messages. The drug doesn't go into the cell and control the cell. Again, in the area we're discussing. I'm not covering all of medicine right now. So the ligand goes into the receptor. The receptor has 2 or 3 messages it could send into the cell. There's roughly 7 million receptors on the average cell. And cells are small. So it's hard to do this math. Its numbers are a little overwhelming for me, these kind of numbers. Multiply that by 75 trillion cells, and you really get confused. So the cell wall has got about the integrity of a soap bubble. And it's a lipid bilayer, which means it's oily, fatty, which is why you have to eat salmon and not McDonald's French fries, or your cells will be in omega 6s. You want omega 3s like salmon, fish oil, or omega 9s, olive oil. Stay away from the 6s. And so on these cells, like lily pads, float these little receptors. And the receptors, which receptors are saying what, or doing what, or controlling the cells in what way, has to do with the life of the cell, and on a more macro level, you, at any given moment in time. And that can change. And that's the good news. It can change. You're not stuck in this situation where you have pain or anxiety or keep getting strokes or have cancer or whatever. You're not stuck there. You can just tell your body to function differently. There's a lot of ways of doing that. Some are really hard. Alpha-Stim's really easy. Dr. Earthman said, well, it's easier to just take a pill and a bottle of water. It's not that hard to use an Alpha-Stim. If you're not motivated enough to use an Alpha-Stim, then you don't have a big enough problem to worry about. So the ligand went into the receptor, and we used to call this the lock and key principle of pharmacology, because the receptor was the lock, and the key that unlocked the message was the drug. And they thought the drug, and it does structurally fit into the receptor molecule. However, what they didn't know 100 years ago, which they still teach today somehow, is that it doesn't have to be in the receptor. It's OK for it to be near the receptor, proximity of the receptor. So what does that mean? That means you don't need the drug. You just have to hit the right frequency for the receptor. I mentioned there's 7 million neurons, so many cells. How are you going to know that? You talked about frequency-specific microcurrent. There's actually a device called frequency-specific microcurrent. And I'm like, where's the database? You said trial and error on every patient. Geez, what for? Why not a shotgun approach? Is it going to hurt? I mean, let's say we use the wrong frequency. Can that create a problem? Well, let's think of it this way. I am talking to you through frequencies right now. I'm vibrating my we'll just say throat, and it's vibrating your ears into tympanic membrane. And hopefully it's meaningful to you because I'm using frequencies that in an accumulation forms a language that we call English. Help me out here, Tomo. How do you say in Japanese, this room is on fire, get out now? Okay.
We could get out quicker with what he said.
I almost repeated that, but I don't think I can. All right. If I said to you, the room's on fire, get out now, you would, hopefully, unless you think I'm just a complete joker. But you know, you'd probably look around, look for the fire. But if Tomo said it to you, you'd probably say, hey, I just remembered I promised to buy my cat a new sweater. I gotta go. Tomo said the same thing I did, but he said it in a different language. And that's the way your body works. Livers speak liver, kidneys speak kidneys, bones speak bones, muscle speaks muscle, nerve speaks nerve. If they don't communicate, if the cells don't communicate with each other, then they just say, hey, the hell with you guys, I'm on strike, I'm not gonna work anymore, but I'm gonna have sex and reproduce because I like that part. And that's what we call cancer. And so your cells have to communicate, they have to work in an organized group setting. They can't just do whatever they want. We'd all be blobs for a few seconds before we disintegrated. There's no way to hold us together and have any integrity and have this amazing thing we call life, whether it's a human or a cockroach. I mean, it's still amazing. And so we do that by having communication systems. So what is the Alpha-Stim doing? Well, it's putting a shotgun approach, or a wide range of frequencies through the area. Now, through the area is important. You have to put the probes in the right place. You know, if my foot hurts, and I put one probe here and one probe here, chances are my foot's not going to feel much better. That's a little different with the brain, because the brain is the CPU. We'll get to that one. Central processing unit, you know, like in electronics or in computers. So you can affect the whole body from the brain. But site specificity in treating pain is very important, unless it's centrally mediated pain, which is in the brain, like fibromyalgia, multiple sclerosis, migraine headaches, and a lot of other things. That's just treated on the brain. So think of a car door. Remember when you used to have to walk up to the door, pull a key out of your pocket, turn, oh, carpal tunnel, I worked that key. But now, well, then you used to have to take the key out of your pocket and press the button. Now you just walk up to the car and touch it. But that's still the frequency, talking to each other. And the cars around there are not, did you ever see a car throw up while you were opening your car? I mean, none of them got sick, even though that wasn't their frequency. I mean, none of the other car doors opened. So you're doing nothing at all, just like speaking another language. Didn't hurt at all. So the other frequencies are harmless, but the ones that the cells, that activate the cells are very potent and also harmless. You can do a little experiment with tuning forks if you have two of the same frequency and you activate one and hold it in proximity, but not touching the like tuning fork will vibrate. But if you have a different tuning fork, nothing will happen. Same exact concept, very simple experiment. So that's what the Alpha-Stim's about. The waveform is virtually going from 0 to, well, we chop it in half, but 2 seconds. That's 1/2 hertz. That's why we call it 1/2 hertz. It's not 1/2 hertz. It's the complex waveform. These spikes, which last about 10 microseconds at the base, I don't know if any of you have a microsecond hand on your watch, but it's quick. These are the things you might feel, but that opens a resistance window in the skin. Without that, this pulse is too weak to go through. This is going from virtually 0 to 2 seconds. And think of it like you're strumming a guitar and you're moving your fingers all the way up and down the frets. So those strings vibrate. But their vibration is not one single frequency. It's what we call harmonics, built off of the frequencies. So inside this thing, which we call a modified square wave envelope, this is 0 current, this is going one direction, that's going the other. Inside this area, we have harmonics. And here's one of those numbers that don't work for my brain anymore. Supposedly, we have an infinite number of frequencies. I actually don't believe that. I think what we have is a wide biological range. Engineers tell me we have an infinite. Now, this is an oscilloscope. If you look at a spectrum analyzer, you can break it down a lot more. most people look at things on an oscilloscope. It's more useful for our needs. Anyway, so that's the idea of the waveform. Every 10 seconds, it repeats. So it's not a drug. It's a pharmacy. In fact, it's a lot more than a pharmacy, because it'll do more than we have drugs for. We have drugs for everything if you consider pain control, no matter what you have, you know, or happy pills. All right, so we can treat any pain in this manner. Now that sometimes turns off a doctor, but pain is pain. It's a complex central nervous system process. It's not just dealing with micromanaging one little physiological function. It's compensation patterns all over the body. And that's how we have to treat it to be successful at treating it. And that's what I'm going to talk about in a moment. So pain, any pain. Now, what is the goal of pain management? The pharmaceutical industry says, we can reduce your pain 32% with strong narcotics. Isn't that great? I don't even have time to start listing the side effects. So let's just say, yeah, that's good because it accomplishes the goal of pain management, which is, oddly enough, not to get rid of the pain or even to reduce the pain, but rather to allow the person to accomplish ADLs, activities of daily living. That's the goal in pain management. If you can brush your teeth, put on your pants, you know, feed yourself, you're good, even if you have the same amount of pain. And there's some really good studies. One of my favorites done at Scripps in California, where they did counseling, and they did things, but the pain wasn't not reduced at all, but the person lived a more productive life. And that's a lot of what it's about. However, here's where things get really, really strange. Because, you know, we're all a collection of psychopathologies anyway. So the doctor says, you have rheumatoid arthritis. You're going to have to learn to live with your pain. I'll give you something to decrease it a bit, but you have to learn to live with your pain. So you go home to talk to your friend Jack Daniels, or Johnny Walker, or one of those guys. So you go home, you start drinking, and you basically say, okay, now I have to learn to live with this pain. And you develop this neurotic relationship to the pain. Because you interpret this subconsciously, I'm going to die without my pain. So now you're holding on to your pain. I got to have this pain. I'll die. The doctor told me I'll die. And he had a white jacket on. So he must know. That may not be a conscious thought, but that's a thought. Whether conscious or not, that's affecting every pain patient. And they've tried all these doctors, and then they see you. And you say, and they say, I don't think you can help me. Yeah, I've been to orthopedists, I've been to the neurosurgeon, I've been to chiropractors, I've been to physical therapists, I've been to acupuncturists. And you say, that's what we do. This is America. Of course you got drugs first. It's unethical and almost illegal not to give you drugs. This is America. We're a drug society. Find me 2 blocks in a row that doesn't have a drugstore on it. Try to watch TV for 10 minutes without seeing a drug ad. You know, that's where it's about, and that's where the money is. The richest companies in the world before the .com thing. And so now of course you're on drugs. And of course you tried all these things. But we wouldn't be here, we wouldn't be in business if this didn't work for people who all that stuff failed on. Because if drugs just work fine, there would be no Alpha-Stim. Wouldn't need it. Drugs don't work fine, and they're not going to work fine. They're not going to develop the perfect panacea drug. Someone said, is Alpha-Stim a panacea? Pretty damn close. But some of it's operator error. You know, Tracy's got a great line that says, it doesn't work if you don't take it out of the box. That's true. It also doesn't work if you take it out of the box and try to eat it. You know? It's not a pill, big pill. You can't chew it, just can't eat it. Banging it over your head, that doesn't help either. Putting it on the floor and tripping over it, nah, no therapeutic effect whatsoever. So you got to use it right. So that's what you're here for. And you're going to learn how to use it right, not here today, but from experience. Don't do what I just told you doctors do. Don't do the same thing over and over again when it's not working. Think outside the box. Go further. Stanley Hoppenfeld, Examination of the Spine and Extremities, is a great book. After you go treat a shoulder, go home, get this book, and read about the shoulder and how to analyze it and the anatomy and all that. If you want to go that far. I will tell you, you should read every Alpha-Stim study. And the easy way to do that is you go to the Payers tab at alphastim.com. And in there, you'll find a link to the clinical examination report, which is a regulatory document we do for Europe. And that is only 175 pages. It's a summary of our research and the mechanisms. And when you read that, when you get to the end, start again. And then when you get to the end, wait a month and start again. And then you'll know everything there is to know about Alpha-Stim. If you become expert in this, you'll do better. And I also think you should look at all the media on the website. Don't just stop with Reese here on our homepage. Click to see more media. And if you haven't watched it already, you can watch me on TV when I started the company. I had a Jufro and color in my hair. All right, so activities of daily living. Now, when your computer breaks, what's the first thing you think about? Is it the mouse? You know, oh, computer's not working. Let me go check the mouse. Looks like a mouse. This looks good. Change the battery. Nope, computer still doesn't work. So look at the tower. Look at the CPU. However, let's say your wrist hurts. What's the first thing you think about? The wrist. But you might have had wrist pain, and then on the way to the doctor's office, you got into a car accident, and they had to amputate your arm. Still got wrist pain. What are you going to treat? Well, there are some idiots out there who treat the stump. That doesn't work. There are physical therapists that treat it with their applications of force, because physical therapy modalities are applications of force. Alpha-Stim is not. It's a completely different universe we're in. And there's surgeons that'll keep slicing and dicing that amputated site to try to get that specific area where it's not going to bother the nerves. Nonsense. It's in the brain. The brain is looking for incoming data. The brain is saying, hey, wait, why aren't all my troops reporting in? Why do I have this empty place? So it sends out dendrites to the other part of the brain to say, hey, you know, give me data. I'm hungry. I need information to process. And this causes all kinds of problems, including pain. But you can treat it in the brain. One interesting means of treating phantom limb pain of the legs is a mirror. Dr. Melzak found in Canada figured out if he just shows them, because people say, oh, my legs hurt. Well, look at them. They're not there. And that actually helped. Alpha-Stim works better than that. So we treat the brain. And if I have to choose between treating the pain and the brain, I'm going to take the brain every time. However, it's best you treat both. There's, you know, a few nervous systems. There's the central, the brain and the spinal cord. There's the peripheral, arms and legs, basically, around the torso and the outsides. And there is the autonomic, the sympathetic and parasympathetic. Then there's that other one, which is the electrical. And again, it precedes and controls the others. So that's the one you want to get to first.